Cal Cates. I'm the executive director of Healwell. We are an organization that partners with medical centers, clinics, hospitals, anywhere people living with serious and chronic illness may be found. And we bring highly skilled massage therapists into the standard of care.
Hi, I'm Laura Bryant-Earner. I'm the service director for Healwell. Healwell is a nonprofit organization of highly skilled massage therapists. We provide touch and massage to folks living with chronic and serious illnesses. And we just bring our presence and our abilities to folks where they are.
Hello, my name is Hunter Groninger, and I am a palliative medicine physician at MedStar Washington Hospital Center in Washington, D.C., where I direct this program. I'm a professor of medicine at Georgetown University and co-director of the Palliative Telehealth Connecting Hospital to Home, or PATCH program, that is a community-based longitudinal palliative program for our patients and their families in our area.
Catherine Walker. My title is Assistant Vice President for Palliative Care at MedStar Health, and I'm the clinical director for the PATCH program. So our PATCH program was designed to really mimic the team-based concept that we found so valuable on the inpatient side for palliative care. So some of the disciplines are very familiar to palliative care. So we have our providers, nurse practitioner, physician. We have nursing. Clinical pharmacists are really big here at MedStar, and our clinical pharmacists are a key part of our team, as well as clinical social workers. Our initial PATCH pilot was primarily the palliative care social worker and palliative care clinical pharmacist. We have chaplains integrated into our program, and importantly, massage therapists in our DC area that have been a huge part of our program.
Palliative care is a discipline that serves patients who have a serious illness, often a chronic progressive illness, as well as their families, to provide holistic supportive care. And the intention of good palliative care is to be able to provide this interdisciplinary care across care settings. Last year at MedStar Washington Hospital Center, our inpatient consultation teams provided over 2,500 unique inpatient consults to patients with serious illness. But providing support to these patients and their families really cannot stop when they leave the hospital at the time of discharge. And it was absolutely critical that we figure out innovative ways to reach patients and their families at home to continue this care longitudinally. The PATCH program is a program that has been our attempt to begin to provide that longitudinal support for patients in our community. And we're very excited to have been able to pilot it and for it to continue to grow.
It's often when we first call and introduce ourselves, there are many questions about how a massage session will look. And so it's very educational. And then I am just so honored that we work with these people who allow us into their homes. And we are literally the hands, the feet, and the eyes and ears of the PATCH program. Many of the practitioners, because this is a telehealth program, interact with the patients via a tablet. And the massage therapists have this amazing opportunity to go into someone's home, spend time with them, able to look around and really be a conduit of information between the patient and other practitioners as well.
We've already seen the number of patients who are benefiting from massage therapy specifically. We're collecting semi-structured interviews and data about what is the experience and how does the addition of massage therapy affect that, not just from the patients, but from the clinician perspective. Most clinicians that Healwell works with at MedStar and in other partner relationships haven't had the experience of working with massage therapists who are prepared to work as part of an interdisciplinary team. So for us, it definitely inspires us to cultivate a larger workforce of massage therapists who can meet this need and who can participate in these teams. And the future of our community-based care model, certainly with MedStar, feels limitless at this point.
It has been critical to us as a telehealth-based program to have our massage therapy colleagues who are part of our team being able to go in the home and really can help us to make that final connection directly with patients in their homes.
And when you have that interpersonal interpersonal relationship with another part of your team, we hope that we can see those numbers go down. And Laura, as one of the therapists really doing that work in the home and who works to mentor our team of therapists to go into the homes, has some great stories of just the relationships that have been built in these weekly visits and bi-weekly visits with patients.
An experience I had was one of the caregivers really wanted to speak to the chaplain, and she couldn't get a hold of the chaplain. And so, was able to just call the chaplain and say, this person really needs your support right now. And we were able to just facilitate it. So I think that's a piece that massage therapy can provide, is just facilitating communication. And that is, nowhere to go but up with that piece of it.
If you just think of palliative patients that we've interacted with on the inpatient side, and Patch would be an appropriate follow-up clinic for them, that would really significantly increase our numbers, not to mention the fact that the ultimate goal for Patch would be to get to patients before they even had a hospitalization. So I think even just from that initial group, there's a significant need for expansion.